Recovery Advocacy Documentary Action Research, Radar est un groupe d'universitaires et de cinéastes qui créent de courtes vidéos et des documentaires plus longs sur des sujets touchant la santé mentale et la maladie mentale. Radar a reçu des fonds pour créer 3 vidéos communautaires sur la relation entre le cannabis et la santé mentale. Le projet vidéo était le suivant. Une coproduction. Utiliser la vidéo participative en vue de réduire la stigmatisation et de sensibiliser le public. Dr. Rob Whitley.
One thing that Radar has been interested in for many years is alternative routes of healing. So we know that when people are in recovery from mental illness, there are many factors that can enhance and enable that recovery. There is what happens in the official healthcare system, including medication, talking therapies, etc. And obviously that can be very helpful for many people. But one thing we've learned from our many years of operation is that there are things outside of the healthcare system which can be very important for healing and recovery. And in some of our previous studies, the topic of cannabis has come up and natural remedies. And we thought it would be very interesting to produce some kind of documentaries about the topic of cannabis in the context of it being a natural product, a product that's been used by Aboriginal people for hundreds of years and other subcultures, and something which is somewhat stigmatized within wider society, partly because it was an illegal drug for so many years. So we felt, as part of our mission, it was important to shed light on this issue in an unbiased, fair and balanced manner, to try and educate the public and inform people who will be watching our videos. The aim of this project was to produce educational and informative videos about medical cannabis. Our aim was to produce around 3 videos, which we were able to do, and our secondary aim was to show these videos to a variety of target groups, including healthcare providers, students, educators, the general public, and to evaluate what kind of impact these videos had on the viewer. So it's what's known as an action research project. There was an action component, which we succeeded in doing, and there was a research component, which we succeeded in doing, but not to the extent we hoped for because of COVID-19.
Richard Dirado.
We did everything remotely, so we used StreamYard, and I set up the participants with the light, the sound, and made sure everything was framed well. So it was like looking through a camera, but through your computer. And I think also by doing it like remotely is we could go further. Like if I was going out to film people, it would be in Montreal, and that would be it. But with this, we could reach out to anybody really, and it was like across Canada. So we went from Montreal to Vancouver to back to Newfoundland, and it was like a really good way to connect with people.
Myself as the director, I have very little involvement because I'm partly a figurehead. We're a collective, we make decisions together. But in terms of making the day-to-day decisions about producing videos, the content, what's included, what's excluded, that's made mostly by the filmmakers on the ground. And we had 4 core filmmakers in this project, and they would meet, discuss. I would occasionally meet with them. We had technical assistance from a professional videographer who helps us with some of our projects as well. So the success of the project is really down to the filmmakers. So Radar is officially not a professional film crew because it's not our full-time jobs. We don't work 9 to 5 as filmmakers, but we are all committed to videography. We all have a lot of experience in videography, and I think if you watch your videos, many people would not understand or believe that we're not a professional film crew, because we use our experience and we always try and make our videos to industry standard. We hold each other to very high standards. We make several cuts of all our videos, and we go back and forth, and only after a long process do we release them to the public.
The videos themselves hopefully will educate people, and will also reduce stigma with like mental health, but also with cannabis, and that it can be used for something healthy and beneficial. So when I was making the videos, that's what was in mind, that hopefully this will, get out there and people will benefit from them.
Veuillez prendre un moment pour regarder les vidéos à l'adresse suivante: radarmentalhealth.com. Projet de recherche communautaire de la Radar Mental Health, Université McGill et Institut universitaire en santé mentale Douglas. La Commission de la santé mentale du Canada. commissionsantémentale.ca. Les points de vue exprimés dans le présent document représentent uniquement ceux de l'équipe de recherche. La production du présent document a été rendue possible grâce aux travaux de recherche sur le cannabis et la santé mentale de la CSMC et à la contribution financière de Santé Canada.